Everyone, and welcome to the Flint Community Webinar, your community resource every Friday at noon. We're so excited to be back with you today. We've got a lot of great resources that we're going to be talking about today. We've got some really great people. We're going to start off talking to Hillary Hatch, Public Affairs Specialist with the Social Security Administration. She's going to be talking a little bit about working and receiving Social Security disability insurance. We've brought Leon back, who's going to be talking to us about the MAID Institute and all of his incredible work, talking about supporting the needs of returning citizens. We've got Dr. Kara Poland here today, who's going to talk to us a little bit about their work with ACORN. And we've got Cheryl Dawson, who's going to talk to us a little bit about Flint Soberfest. So wonderful resources for you today. We're going to start with Hillary. Thank you so much for being here today.
Yeah, thank you so much for having me. I'm very excited to talk to everyone about our work incentive and employment support programs. Let me pull up my slides here.
Absolutely.
Okay.
Perfect. You can see it. Perfect.
So there are tons of work incentives and employment support programs for our beneficiaries. One of the most common misconceptions that we hear when we talk about working while receiving benefits is that individuals think if they do work, they will lose their benefits. And that's just simply not true. So individuals can work and continue to receive their monthly cash payments and maintain eligibility for their health insurance. And those are the types of things I'm going to be talking to you about today, some of our different employment support programs. It's a ton of information in a short amount of time, so we're just going to do a very brief snapshot, but I'll give you some resources and some instructions on what to do if you do decide to return to work. So one important thing to remember is that Social Security has 2 disability programs. And because we have 2 programs, that means we have 2 sets of rules. So we have the Social Security Disability Insurance Program, or the SSDI program. And to be entitled to that program, it is based on how much you've worked and paid into Social Security. So you have to have a certain number of work credits to qualify. And those that are entitled to SSDI are entitled to Medicare. And then our other program is the SSI program, the Supplemental Security Income Program. And work is not a qualifying factor for the SSI program. So this is a needs-based program. And individuals that are entitled to SSI are entitled to Medicaid. So again, we have 2 programs, and that means we have 2 sets of rules. And why this is so important is because if you're receiving benefits or you're working with someone that's receiving benefits, and let's say you were to call Social Security and say, oh yeah, I get disability and I'm thinking about going back to work. How's that going to impact my benefits? Well, if you say I get disability, we're going to automatically assume that you get SSDI benefits. So it's really important to know whether it's SSDI or SSI. Now, when you call Social Security to report work or to ask about work, we should be verifying what type of benefit you receive. But if you're an advocate that's working with someone and they're not sure what type of disability or what type of disability program they're receiving benefits from, one thing you can ask them is, well, when does your payment come? So not everybody knows the type of benefit they're getting, but they definitely know when their payment comes. And if they get their payment on the 1st of the month, then you will know that it's SSI that they're receiving. And if it's the 3rd of the month, then it's SSDI that they're receiving. So employment support provisions, they are there to assist our beneficiaries in moving from benefit dependency to independence. And they're really designed to help our beneficiaries either enter, re-enter, or stay in the workforce by protecting their eligibility for their cash payments and for their health care. So again, this is just a very, very brief snapshot of what the work incentives look like for someone that is receiving Social Security disability, so the SSDI program. So when someone is receiving SSDI, they are entitled to what we call the trial work period. And the trial work period, it's 9 months, but it doesn't have to be a consecutive 9 months. And basically the trial work period is when an individual receiving SSDI can work and make as much as they want, and they're still going to get their full Social Security disability payment. Now, we consider a trial work period, it's based on a dollar amount. So if you make more than $1,050 in gross wages, you've used one of your trial work periods. So if you make $1,051 in gross wages, you've used one of those trial work periods and you still get your benefit. If you were to make $5,000, you've used one of those trial work periods and you still get your benefit. Now you have 9 months. Once you've used up all of those 9 months, you go into what we call the extended period of eligibility. And this is essentially a 36-month re-entitlement period. So during those 36 months, if you make over the SGA amount, which is the $1,470, you're not due your benefit. If you stay under that SGA amount, you are due your benefit. Once that 36-month period has ended, if you make over that SGA amount, then you're no longer due benefits at all. Your Social Security disability benefits would terminate. So that can scare individuals sometimes because they think, well, what if I go back to work and my benefits terminate, but a year later I can't work anymore? So can I just not get disability anymore? What's going to happen? Well, then you could qualify for what we call the expedited reinstatement. And with the expedited reinstatement, this is for individuals that have, their benefits to disability have terminated, but they're no longer able to work for whatever reason. So they don't have to reapply for benefits. We can have them use the expedited reinstatement process as long as that request is made within 5 years of when those benefits ended. So that's just a very brief snapshot. Another big piece here is Medicare. So there are a lot of individuals that return to work and they're not really concerned about the cash payment because they're working, so they have income coming in, but they're concerned about the healthcare piece. So if disability payments ended due to work, coverage will continue as long as they still meet those disability rules. And that Medicare coverage can continue for at least 93 months after the trial work period ends. So that was a brief snapshot of SSDI benefits. And now I'm going to talk a little bit about SSI benefits. So SSI, again, Supplemental Security Income Program. This is the one where benefits come the first of the month, and it's our needs-based program. So with SSI benefits, the first thing I want to talk about is the earned income exclusion. And this is really just the way that we calculate how your work impacts your SSI benefit. So the maximum that anybody can receive on SSI for this year is $914 a month. Let's say someone goes to work and they're making $585 per month. So we subtract 65, we subtract another 20, and then we divide the remainder in half. So that's what would be considered the countable income. And that's what the SSI payment is reduced by. So if someone is making $585 per month in gross wages, the countable income comes out to be $250. So the SSI payment would be $664. So sometimes beneficiaries will be a little bit hesitant to work because their SSI payment is going to decrease. So although the SSI payment is decreasing to $664, they have wages of $585, which makes their total income more. There is also our Section 1619A in section 1619B, employment supports. And both of those, they have to deal with Medicaid. So with 1619A, that's just basically saying a beneficiary that's receiving SSI can work, and they can have their income from wages, they can have an SSI cash payment, and they can maintain eligibility for Medicaid. 1619B is very similar, but this is for an individual who is working and the amount of their wages makes them ineligible to receive SSI. So for a beneficiary that's receiving SSI, returns to work, and their income is too high for them to get an SSI cash payment, they can still maintain eligibility to Medicaid. And that's huge. That's so important for so many of our beneficiaries. So the one thing to keep in mind that I cannot stress enough is that you have to report your wages to Social Security, no matter what type of benefit you're receiving. It's so important that you report to us, and you report to us timely. Failure to do so could result in an overpayment. And it's not just reporting when you start work, but any sort of changes in your work activity. So if you stop work, if your pay has changed, your hours change, if you have to start paying for expenses that are needed in order for you to work due to your disability, all of that should be reported to Social Security. And there are a couple of different ways to report. Again, it's going to be based on the type of benefit that you're receiving. So for individuals that receive Social Security Disability Insurance, or SSDI, they can create an online account, a My Social Security account, and they can report their wages online. They can also fax or mail their wages to their local Social Security office. Now for SSI beneficiaries,
All right, looks like we might have some technical difficulties. Okay. Blair, did we lose her? Let's check in.
Yes, we lost her. So maybe we'll just move forward and then come back to it.
That's totally fine. I just wanted to see if she completely went away, and we can come back to what she was saying. That's totally fine. It was such good information. Looks like she might have lost her internet. I want to give her a couple seconds here and see if it pops up. Let's just see here. Let me see. Dr. G?
Yes.
Where you are in the community, can you talk to us a little bit about the populations and their concerns about SSD and any questions that you've gotten?
Most of the questions that I've gotten is about mostly like with veterans population, that how they can have their veteran disability and their SSI combined, and if there's a threshold. I know there's like I think $14,000 threshold. Is that correct? Threshold where they are able to work. So that's what's kind of stopping, like how you can have both benefits.
How you can have veteran disability and SSI, and that'll be a question that we can bring back to her if she gets back on. Oh, I see that she's struggling. Okay, no worries. We are going to move things around if it's okay with a few of our panelists. I see both Cheryl Dawson and Dr. Poland, and if you are free, we're going to advance a little bit to that portion of our webinar. And then when Hillary gets back up and her internet is working, then we can talk about the rest of the questions we have on Social Security. So either Dr. Poland or Cheryl, are you available to move next?
I am.
All right. Someone said I am, and I didn't catch who. I'm sorry.
Cheryl Dawson.
Hey, Cheryl. Thank you so much. Cheryl, it's so good to talk to you. We have heard so much great information about Flint Soberfest, and I wanted you to have an opportunity to talk a little bit about what Flint Soberfest is, when it is, what you're expecting, and how it came about.
All right, so the Soberfest is this Sunday, July 16th. It'll be our 29th annual, and it is at the Union City Ball Fields, 4151 Torrey Road here in Flint. And I got my flyer here so that I'm trying not to forget anything. So we have a softball tournament that starts at 7 a.m. We have open speakers, and those are just people who are in recovery, who are sharing their experience, strength, and hope. We have a Union City duck pond, which we used to have a trout pond where the children can fish for the trout, and if they had a marker on it, they would win a prize. Now we have ducks because no one wanted to clean the trout. So we have a horseshoe tournament. We also have entertainment by Magic and Escapes. We have a DJ. So in between the speakers, we'll have karaoke. And we have a cornhole tournament, face painting. We have a box lunch for $2, and it comes with a hot dog, bag of chips, pop, and ice cream. And we have 50-50 raffle. It's just a really exciting day. It got started, we had a group of recovering people in our plant. They came from truck and bus, UAW Local 598, and they had started a lunchtime meeting. Mm-hmm. And in that meeting, it was just recovering people, alcohol or any kind of drugs. And they decided they wanted to have a family picnic. And it started out as like a picnic with like maybe 300 people. And today we see it in attendance anywhere from like 2,000 to 3,000 people. So we're really excited about that. And the people, our founders that started the very first one, they still come out and volunteer, even though they are retired. So we're really excited.
That is amazing that you provide all of these resources. And Dr. G was mentioning in the chat that Genesee County Community Health Center and Michigan United will be providing vaccines at Soberfest, which is amazing.
Yes. We have Al-Anon out here. It'll be, it's a lot of them. Let me see if I could think of some. Odyssey House.
Yeah.
Apps will be out. A lot of our community resources. So like they're doing the immunizations, and then we have the Flint Lions Club will be here.
Right.
It's a lot. I can't think right now.
No, that's totally fine. When did it start?
Yeah, it's a fun-filled, family-friendly day. We also do a bike raffle. So the children who are in attendance, it's free of charge. They get a ticket. The parents get a ticket. The children get an armband with the ticket number on it. And then they get to take extra tickets because it's 2 tickets. So one stays with the parent and one goes into the box of the bike that they like. And then we raffle those bikes off. So that's really exciting to see the little children leave with the bike. So I purchased, I want to say 35 bikes, but between now and Sunday, we'll get more bike donations. So,
and who generally donates? Like, who are you all reaching out to in the community that donates to this event?
Clarence, we have Christ Fellowship Baptist Church, Morning Star Baptist Church, New Path, Odyssey, Genesis GHS.
So you just have a bunch of communities.
It's over 100 sponsors. Yeah.
That's fantastic. And you said this is the 29th annual. So you've been doing this for 29 years?
9 years, yes.
Wow. There's a couple questions in the chat. There are people asking how they can donate.
How you can donate? Well, you make the check out to the MOST group. That's MOST group, and it stands for Maintaining and Organizing Support Together. That's the name of our recovery group in the plant, but it is a nonprofit.
Mm-hmm.
And the address is.
Don't worry about the address, but knowing that they would write it, they would write donation checks out to MOST.
To the MOST group, yes.
Fantastic. Tell us a little bit about the MOST group. So you all have been running this Soberfest for 29 years. Are there other community events and other work that MOST is doing?
Yes, so at Christmas time, we do holiday food baskets. So whatever proceeds we have left over from this, and then we do a gate collection at the plant in October. And those proceeds, we get that money together and we see how many food baskets we can buy. How a person gets a food basket is we have our membership, the employees, nominate a family.
That's so fantastic. Yeah. That's fantastic. And again, remind us, UAW local what chapter? 598. Thank you so much. And then just hit the dates again so people know and the time where they can show up.
All right, it's July the 16th, this Sunday. The hours are 8 a.m. to 5 p.m. and it's at 4151 Torrey Road, Flint, Michigan 48507. So the airport is on one side and the ball field is right across the street, right on Torrey Road.
This sounds like it's going to be such a great event. Thank you so much for all of the work that you are doing.
Thank you for having us.
Absolutely. All right. I see Hillary is back and I'm going to go ahead and let her finish answering, finish giving us that wonderful information she was providing us. And then there were a couple of questions that we had from the chat. So I'm going to let you finish the presentation and then I'll bring those questions up for you.
All right, thank you so much. My internet went out and it's like, oh no, I'm just talking away. I don't have very many more slides. Let me bring that up. And in fact, so, I was talking about reporting your wages and how important it is for SSI beneficiaries. They can report their wages online, just like SSDI beneficiaries, but SSI beneficiaries can also download our wage reporting application or call our 800 number, and they will just follow the prompts in order to report their wages that way as well. Only the person reporting wages needs to have an online account. So if you're the person that is getting benefits, you would sign up for your own My Social Security account and report wages that way. If you are a representative payee, you would sign up for your own Social Security account and you would report the wages for the individuals that you are payee for. And when we talk about a deemer, this is the parent of a child that is receiving SSI. So if you have a child that is receiving SSI and you're working, and maybe both parents are in the household and both parents are working, each parent would sign up for their own My Social Security account to report their wages. When you go to our website, if you haven't done so already, to create that account, it's going to be at the very bottom where it has that My Social Security account there with that red circle around it. And this is what you're going to see when you report your wages. It's going to ask you to submit your pay stub information. You're going to choose your employer, and we're going to ask some questions from your pay stub. So we need to know the pay period start date and end date, your gross pay, and the date that you received the paycheck. And then once you submit that, you'll have a receipt. So one of the best guides that we have to our work incentives is our Red Book. This is available in a PDF version online. If you want to order a Red Book, you actually have to go to the PDF version, and on page 4 of the Red Book, it tells you how to order it if you would like a paper copy. But the Red Book has very detailed information on all of our work incentives, but we also have some other resources that are a little bit easier, I think, to read through. We have a publication that's available on our website. So our website is ssa.gov. At the top, there's a search box. if you were to type in working while disabled, you'd have access to this publication. It's just a snapshot of the different work incentives that we offer. We also have an entire website dedicated to working while receiving benefits, and that's ssa.gov/work. And then if you are someone that is receiving SSI or you help individuals that receive SSI, we also have a website dedicated to SSI beneficiaries. And in the additional resources link, it will tell you all the different ways to report your wages. But the number one thing to keep in mind is that if you are receiving benefits and you return to work, or you're thinking about returning to work, know that you will not lose your cash benefit. You're not going to lose your healthcare insurance, and know that you have to contact Social Security to let us know when you start working. And when you do that, when you contact us to let us know you've started working, we can walk you through the process, and we can help you make a decision on which will be the best way for you to report your wages. Or maybe you're just thinking about returning to work. You can contact your local office and they can walk you through the different employment supports that we have. I know it's a ton of information. So that sums it up. That's returning to work while you're receiving benefits in a nutshell, I guess.
That is fantastic information. We've got a few questions, if that's okay.
Absolutely.
All right. So the one question we have is, what is one of the biggest myths that you'd like to dispel around people trying to access SSD and SSI benefits? And you touched on some of them, but as we leave people with sort of final thoughts, what is one of the biggest myths you want to address?
So there's a couple of them, actually. So
Okay.
The number one myth that we hear is individuals think that everyone gets denied the first time that they apply for benefits. And that's simply not true. Not everybody gets denied the first time that they apply for benefits. The other myth is in regards to work. There's there really is a really big misconception out there that if you get benefits from Social Security and you go to work, you're going to lose your benefits. And that's also a myth. You can work and get benefits and still get those cash payments and still maintain eligibility for Medicare or Medicaid.
That's really fantastic information. So in my office, when people are thinking about disability, there's also this myth that I wonder if you would touch on, of people thinking like, oh, I have to get a lawyer involved to get disability, or it's going to be a really expensive process. Can you talk a little bit about that?
Sure. So when an individual decides to file for disability benefits, you do not have to have an attorney or a third-party representative to assist you in that process. You can if you would like to. That's completely up to you, but you certainly don't have to. I would say most of the time when people obtain an attorney is if they apply for benefits and are denied, and then they file an appeal. That's a lot of times when individuals will choose to have an attorney, but again, you don't have to, even at the appeal level. So you certainly can apply for benefits on your own. You don't need an attorney. Everyone has the right to file for Social Security disability and SSI, and that process is free. There's no cost to do so.
That's fantastic. Thank you so much. You started talking a little bit about this, the idea that just because you might not have been approved for SSD doesn't mean you've lost your health insurance. And can you talk a little bit more about that? Like, what is it that you see people worry about? Why would they be worried about losing their health insurance? Maybe you can give us some more context for that.
So with Social Security, when individuals are receiving benefits from us, if they're getting Social Security disability, then they're entitled to Medicare. If they get SSI, they're entitled to Medicaid. And so, there's a lot of individuals that think if they go to work and they're no longer getting that cash payment, that means that they will no longer get their health insurance either. So they would lose their Medicare and their Medicaid. But that's not true. So even for individuals that are not receiving a cash payment from us, they still have to be eligible to receive benefits. So they were receiving benefits at some point, but then because of their work, they're no longer getting benefits. So they're not getting the cash payment anymore, but they can still maintain eligibility for their Medicare or their Medicaid.
Fantastic. Is there anything that they need to do to make sure that you described really well this idea that if your work status changes, right, you need to let us know. If their work status changes and they let you know, is there anything people need to be aware of to make sure that their health insurance stays intact?
So for SSDI beneficiaries, well, for both beneficiaries, for both types of disability programs, it's important just to keep Social Security updated with your information. With SSDI beneficiaries, you will automatically maintain that eligibility for Medicare. We don't do reviews, or we call them redeterminations. We don't do those with SSDI beneficiaries like we do with SSI beneficiaries. So if someone's receiving SSI and they are no longer getting a cash payment because they're working and making too much money, to maintain eligibility for that Medicaid, we're still going to do a review with them. It's typically once a year. So we'll send you a letter in the mail telling you we're going to call you on this date and time. You just want to make sure that you stay up to date with those reviews. And then you'll be able to maintain that eligibility for the Medicaid. So just keep Social Security informed.
Keep Social Security informed. We have a question from Dr. G, who's often talking to people in the community. And one of the things that she said is that her veterans get really worried about keeping their veteran disability and their SSI. And I wonder if you would talk a little bit about that and, what are the resources for that specific population and what might they need to be thinking about?
So that's a great question. And we do see this sometimes with our veterans, is that individuals or veterans that are entitled to a VA benefit, sometimes they think that because they're getting that VA benefit, they cannot get Social Security disability, or that it will impact one another, and it doesn't. So if a veteran is getting benefits from the VA or not getting benefits from the VA, either way, if they're disabled, they can apply for Social Security disability and get Social Security disability plus their VA benefit. And if they start getting disability, it doesn't mean their VA benefit is going to stop. Or if they're getting disability and they start getting their VA benefit, it doesn't mean their disability will stop, or vice versa. So veterans can receive benefits from both programs. Now, our definition of disability is different. So just because someone is getting a VA benefit doesn't mean they're automatically going to qualify for Social Security disability, but they certainly can file, and if approved, they would be getting benefits from both programs.
That makes total sense. That's really, really helpful. Couple last questions. One question that we have from the community was, how can a person get some help if they're trying to navigate this process? And you alluded to some of the systems, but if people have some of the worries that you've talked about, right? They're worried that maybe they're a veteran and that they can't have both services, or they're worried that they're going to lose maybe their health insurance services. Who should they be reaching out to get some help in the process as they look to either apply for new services or make sure that they're following the right steps to keep the current services that they have?
So I think a really great resource is your local Social Security office. I know navigating work and how it impacts your benefits, it's difficult to understand. It can be confusing. It's worrisome. So a great resource is just starting out with your local Social Security office and getting information and asking questions. So I think that would be a great place to start. Another great place to start, if you kind of understand, that if you work, it's going to impact your benefits, but you're ready to do it. You just maybe need help finding work. We have what we call the Ticket to Work program. And on our website, it's ssa.gov/work. It will bring you to the Ticket to Work program page. And this is a free program for individuals that are receiving benefits based on having a disability. And you can work with an employment network And this employment network will help you find work based on what you're able to do. And if you're not quite ready to maybe start work, maybe you just need some training, or you just need to figure out what exactly it is that you can do. Maybe some career coaching or counseling. The Ticket to Work program can help with that as well.
That sounds amazing. So this is a program. Does this program match sort of expertise as well? Like, so things that you have a certain skill set and you are no longer able to work in that field. Does it sort of match people with appropriate? Go ahead. I'm sorry.
Yeah, it absolutely will do that. So when you call the Ticket to Work program, they're going to ask you a series of questions, and then they're going to assign you an employment network. And the employment network is just an agency that will help you, either find work or direct you to some sort of, career services. It's just going to depend on what your needs are.
Right.
But you will go through a series of questions, an interview process, and they will help you obtain work based on what you're able to do.
That's fantastic. In your experience, how long does it take to go through that process?
So it's pretty quick. Once you call the Ticket to Work number, they will get started with you right away. You'll get assigned an employment network right away. And then it's just, when you've been assigned an employment network, they're going to put together a work plan with you. So the amount of time it takes to kind of get to where you want to go, it's just going to be based on your individual work plan.
Fantastic. And then because those are resources through your department, do they automatically, like, let's say someone finds a job, is that information automatically go back to SSD and SSI because it's through the employment network, or is that a separate process?
It's a separate process. So that is an awesome question. Someone is utilizing the Ticket to Work program, even though it's part of Social Security, individuals still have to report their wages to Social Security. So we don't automatically get that information from the Ticket to Work program. You still have to report your wages to Social Security and let us know when you start working.
And that makes total sense. Are these local networks? So like if you're calling from wherever, is the network related to where you are geographically?
So sometimes it just depends on, you'll give the Ticket to Work information to the representative, and I'm sure they look up using your zip code to see what employment networks will service your area. Yeah. And some of those employment networks may be local, or it could be a national employment network. And then they may have like a satellite office that is maybe not necessarily local, but you would be within one of their satellite office service areas.
That makes total sense. The last question we have from the group is, how do you offer bilingual services or services to people who might need your services in different languages?
So on our website, every single landing page that you go to, you have the option to change that to Spanish, but that's the only other language that's available on our website. But all of our forms and publications, they're offered in lots of different languages. I don't know off the top of my head how many there are, but there are a lot. We also have an interpreter service that's available free of charge. So, a lot of our local offices, we have employees that are fluent in other languages. It just kind of depends on, the service area and what language it is that the individual, speaks. But if we do not have an employee available or anyone in the office that is able to speak that language, we have an interpreter service where, let's say it's an individual that wants to apply for benefits, and maybe they speak Vietnamese and we don't have anyone in the office that speaks Vietnamese. Well, when we schedule that appointment for them, we will schedule it through an interpreter service. And at the time of the appointment, there will be an interpreter available that speaks Vietnamese. And that's not anything that the person that's applying for benefits has to pay for. So it's a free service. They do not have to pay for that.
That's so fantastic. So you described a little bit the process for how people access that, but is it just that when they access, they would have to somehow let the team know, like, okay, I need an interpreter for this visit? How does that work?
Yeah, so it's it's for any sort of service that they need. So it's not just applying for benefits, but if it's, just any questions that they have, or they need to come into the office because they got a letter that they don't understand, they would want to make an appointment with us. And when they call our 800 number, the 800 number will indicate to the local field office that this individual needs assistance or needs an interpreter, and then the local field office will ensure that someone is available to assist for that appointment. Typically, how it would happen is if we do not have an employee available that speaks that language, we would call our interpreter service and we would do like a 3-way call. Or if the person is in the office with us face to face, then we would also have to call the interpreter service, and we would have them on the phone with us.
That is such a fantastic resource to know exists in the community. Hillary, thank you so much for your time and all of your wonderful expertise. Do you have any last comments that you wanted to make sure you share with us today?
I don't think so. I think I covered everything. Thank you so much. Great questions.
Yes, no, our community had amazing questions. Thank you so much for all of your time and your attention and your expertise. We'll see you next time. We're going to pivot to Dr. Kara Poland, and I am always so excited when I get to bring my friends and colleagues to talk about their expertise because they're amazing people. Dr. Kara Poland is an associate professor in our Department of Obstetrics and Gynecology and Reproductive Biology. She is fantastic and has real expertise in the area of addiction medicine. We are so lucky to have some of her time, and I'm so grateful to you for being willing to talk to us a little bit about your work with ACORN today. So thank you so much.
Awesome. Thank you. I feel the same way about Dr. Edwards-Johnson. Whenever I have the opportunity to connect with her, I'm like, I'm already sold. Or I regularly send her students, and my preface is, don't be worried because you're just going to have fun talking to her. So that's how I always sell it. So we have Dean Sousa, and I had a brainstorming session talking about addiction and the need across the state of Michigan to support people that have a substance use disorders, and not just opioid use disorders, but all substance use disorders. As I'm sure many people are aware, we are currently in an opioid epidemic throughout the United States, but here in Michigan, 8 people die every day of an opioid overdose alone. When we look at other substance related causes of death, if we add in alcohol, if we add in other illicit substances, we know that we are losing on the order of 50 citizens here in Michigan every day from substance related causes, excluding anything nicotine related. So it's definitely something that is affecting all of us and all of our communities. I'm really lucky to get to work with another colleague of ours, Dr. Jessica Barnes-Najor, who is the Director of Community Partnerships, really with a focus of ACORN being how can we be here for the communities here in Michigan, and another colleague of mine, Dr. Kit Bonner, in the Department of Epidemiology. The 3 of us sort of lead this work. So what is ACORN? It's a real fancy name for a group of us that just like to do a lot of addiction stuff, and we wanted to have a place to play nice in the sandbox. So the mission of the consortium is to inform research, practice, and policy surrounding substance use, addiction, and health. These are kind of our current things that we are working on in terms of building some of that capacity, and really are still in an information gathering stage, looking for community partners, also looking for other faculty members who may be interested in playing with us, because our sandbox has the best toys. And when we look at what are the areas of focus, we have kind of this honeycomb pattern. So we really, again, are focused on community engagement, outreach, supporting the people, the citizens of Michigan, and really having hoping to have a positive impact on the devastation that's affecting us right now. How can we dovetail that with research that will be able to be implemented in our communities, again, with that focus on community, teaching, training, and education of the future healthcare workforce, not only under the traditional kind of prescribing health sciences, where the College of Human Medicine lies alongside the College of Osteopathic Medicine, the College of Nursing, but also working with our, we're currently working with our social work college and hoping to expand to other healthcare related fields, but also we have a partner in communications, right? So how can we communicate this effectively to, to our communities, to our how can we effectively engage them and really being community centered and mindful of how we are perceived when we walk into a community, right? Because we don't want to walk into a community and tell people, this is what you need to do. We want to walk into a community, hear from them, understand what are the pressure points, get to know the resources, get to know the people, and hear and help guide them through the process of, through that process of discovery and through that process of, what are the gaps that need to be filled and how can we partner with the community to assist given our expertise as a university. We're also working with Henry Ford Health, a colleague of mine and I have a planning grant to try to create a family-centered clinic through the Henry Ford system that hopefully will be able to provide some clinical care, but also provide a physical training site for people interested in learning more about substance use disorders. When we look at physicians in particular, we know that they have between 2 and 10 hours of training in addiction throughout their 7 to 15 years of medical education. So it's a huge gap that we are that we want to make sure that we have someplace where we can do some in-person active patient-centered learning, as well as providing, high quality care to at least one of our communities, with, of course, the eventual goal as appropriate in some of our other campuses, including in Flint, to support creating clinics in other places, hopefully with some lessons learned from our piloting in one community. And then outreach and dissemination. So how can we take, the immediate information and literature that's out there, that we kind of are holders of knowledge as a university, and how can we make sure that gets to the right people as quickly as possible? Because we know from research publication to actual implementation takes on average 15 to 20 years. We don't have 15 to 20 years because 50 Michiganders are dying every day. We don't have that amount of time to make sure that we're doing the right thing in the right moment. And then the last branch is advocacy. And this branch is being led in partnership with our communications college, really to support educating leaders, right? So how can we build, both a grassroots and a grass tops organization, that organizational structure, so that we can get that information to legislature and to the governor's office in a timely and meaningful way, but also making sure that we're appropriately leveraging the individuals who are close to this work throughout our state, which certainly are not always kind of, I pick on Dr. Bonner regularly on this one, but I really don't want my epidemiology colleague coming down from his ivory tower and telling us what to do, because it is way more effective from an advocacy lens to hear those real human stories. So how can we elevate then the voices of our community and help provide them with education and training on how to do this with legislature, with other leaders, with leaders within their community, with religious leaders, with healthcare leaders, with business leaders? How can we help them elevate these conversations and do it in a way that has the highest impact? Because you know what? No one taught me how to do that. And I learned a lot of it by trial and error. And I don't want other people to have to make all the errors I did. Please, let's learn from Kara Pullen's mistakes, because I made that for everyone. So how can we partner with our communications folks to help people carve those stories and create those advocacy needs? And right, not me saying, okay, we're going to bring a bunch of people together and train them on this advocacy, right? We're going to train them on this topic that I've deemed as important. But again, we want to make sure that we hear from the communities what is important to them, empower them through our technical assistance to support creating that advocacy. And if I do need to ask Dr. Bonner to come down from his ivory tower to give us some of the statistics, we can ask him to do that very specifically, but not just kind of picking what we want, pick based on the community engagement and the community needs. So to springboard this, Dean Sousa did give us some funding to award some mini grants. So we started with two $10,000 awards, which were given. And I really want to focus kind of on the second one there. So it's out on your side of the state. So really expanding on some of the work and the lessons learned in Flint to support a landscape analysis of SUD treatment resources in Port Huron, Michigan. And so what we really did was we took our mission, we took our pillars, and we said, how are we going to actually do something meaningful in our communities? So the requirements were they had to be talking about intentional partnership with community members. And incorporate that community outreach and engagement. And then selfishly, this was the selfish piece. We wanted collaborators from 2 different colleges so that we increase that that kind of between departments knowledge. And we felt that if we did that, we wouldn't get 2 addiction doctors applying to do something. We might get some more cross-pollination between different types of researchers. To really hopefully elevate the work a little bit more. So we do have approval to reissue them next spring, and hopefully we'll have more information coming from that. The landmarks for it, rather than having people write a report, we want that what they need to tell us is how did they communicate their work, how did they and how did that impact the community that they are partnering with on this grant. So we really wanted people to be intentionally thinking about the possible support that they could provide the communities, but also really just focus on what does the community express that they need, what does the community express that is going to be most helpful for them, and hopefully this becomes a springboard for really integrating some community-based change in our different work groups. So whether you are within the university or a community partner, Acorn is really hoping that we can be a bit of a nidus and a springboard. We did also receive some funding in partnership with University of Michigan and Wayne State University from the Michigan Department of Health and Human Services. And what we are doing is we're really working with communities on community engagement, specifically around the opioid settlement dollars. So if there is a group that is working on that in the Flint area, they can put a request in through the NDHHS website at michigan.gov/opioids. To have the MSU team come in and support a community needs assessment, and just really providing some of the technical expertise for how do we do an effective community needs assessment, because what we found in some of our communities is the money is going by counties and by municipalities, and people just don't know what to do with it. And so some of it is being maybe appropriated in ways that are not going to have the highest impact on the opioid overdose crisis, and because these dollars are specific to opioids, so it is specific to that. But there's about $1.45 billion over the next 18 years coming to the state of Michigan. So we really want to make sure that the community voice is heard in how those dollars are used, again, so that it's not but just a bunch of people sitting in a room saying, well, this would be a good idea, and maybe not the right players in the room, and we want to facilitate that. It does come at no cost to the communities. That's a question that we regularly get. How much is this going to cost us? It's again being supported by MDHHS. So I went really fast, but I end all of my talks to all the people who have lost their lives to addiction and those that try to prevent further losses. I'm so thankful to be here today. As I'm sure many of you who've heard me speak before have heard me say this before, but my brother died of a self-inflicted gunshot wound related to his alcohol use disorder. And so I dedicate my professional life work to his memory, and truly hope that the impact that I have is to prevent other families from suffering the way mine does every day. So as we look at Soberfest, and I believe that's the next topic, so maybe a bit of a transition. As you look at Soberfest, just remember that that is a really awesome opportunity to support people, and to consider ways that maybe long-term thinking about what healthier alcohol use may look like in your own life and in those around you. So with that, I will pause for any questions. And thank you.
Thank you so much, Dr. Poland, for sharing your personal story and your dedication of your career to this work, which is so evident in the energy and expertise that you share. So thank you. I wanted to frame some of the things you said for people, because people understand that MSU has a presence in Flint and they see our students rotating, but we've had a presence that has gone beyond our students rotating in the college. It has been in the work of our public health work and in our community partnerships. And when you talk about Dean Souza, we're talking about the Dean of the College of Human Medicine, who has really sort of wrapped his head around the idea of, we train people in communities, but that is not it. Our spirit and the mission of our college is to do work that is in service of community. I think all of the work that you've described with Acorn is so well positioned to respond to community need and is doing that work. You mentioned opioid settlement dollars, and I know I have some context for what you're describing, but I wonder if you just quickly describe what that means and what you're referring to.
Sure. So there have been national settlements with a few of the manufacturers, distributors, and developers of opioids that are meant to abate to work towards fewer opioid deaths and to kind of prevent the opioid crisis from continuing and changing. So Michigan's share of that money is going to total about $1.45 billion over the next 18 years. So there is an opioid. So there are two different bodies in Michigan that are kind of working on those dollars. One is the Opioid Advisory Commission, which sits in the legislative branch of the government. And the other is the Opioid Task Force, which sits in the executive branch under MDHHS. I just, for full disclosure, I chair the Opioid Advisory Commission under the legislature. But what that money is meant, so in our state, for the different settlements are set up differently, but the largest settlement is set up so that 50% of the money goes directly to communities through municipalities as well as through counties. So Michigan Association of Counties has been a big leader. They do have a wonderful website that has a whole map of what each community is receiving. So that's a really helpful resource. And they have a staff person who is also helping with some of these community needs assessments and is partnering with a MSU team on that particular piece of work. And so that money is supposed to be used broadly in the buckets of prevention, treatment, recovery, and rescue. So the largest portion of dollars in the first year was used toward naloxone and Narcan distribution and other harm reduction services. And there will be an RFP process for this next year's worth of funding, and hopefully some more public facing biannual twice annually, not biannually, twice annual reports from MDHHS on spend plans and how they're spending the money.
That's super fantastic. One of the questions we got from the chat was, how do community organizations partner with Acorn? But you've answered a little bit of how community organizations can partner in this work in general. Do you have a specific way that you would want community organizations to reach out to consider partnership with Acorn?
Just reach out to me directly. You can feel free to disseminate my email and I'll get them to the right person.
That sounds amazing. Dr. Poland, thank you so much for your time and your expertise and the dedication of your work. We super appreciate you.
Thank you. Enjoy Soberfest. I hope everybody has an opportunity to go.
Yes, thank you. Okay, as we wrap up, we're going to give you a couple of community resources that are happening on right now. I want to bring up the slide for Soberfest one more time. Well, we've got Porch Fest, and after that, if we could get Soberfest back up just so people remember it. So Porch Fest, Friday, July 1st, 2023 from 5 to 10 p.m. It's going to be really amazing. There's going to be music, art, crafts, food, opportunities to have exercise and move your body with yoga. There will be pop-up poetry. This is a really great opportunity to get involved and out and into the community. So thank you, Porch Fest. Phoenix Fest is another opportunity to get involved and get out into the community. That's Thursday, July 20th. Lots of different resources. This is being put on by the International Academy in Flint. So thank you so much. Make sure you get out to Phoenix Fest, which is 3 to 7 p.m. Thursday, July 20th. And then a couple back to school events, a free haircut event that's being put on with the Z92.7 in Wayne, the Barber Enterprise. So wonderful event where you're going to be able to get some free backpacks, school supplies, or a basic service. You can get your hair cut, you can get a manicure. There's going to be lots of fun and lots of opportunities to engage. We got Phoenix Fest again. Okay, there we go. I was looking for Soberfest. And don't forget Soberfest this Sunday, July 16th. A special shout out to our community for talking about this work. And this is going to be 8 to 5 p.m. Thank you so much to all of our panelists for a really wonderful webinar. We appreciate you and all of your expertise. Can't wait to see you next week. And a reminder about CUs for community health workers. Thank you.